Happy Friday. Hope everyone's feeling well. All right, I'm going to adjust the camera here just a bit. Make sure everyone can see my at least smiling face. I don't know about how beautiful, but at least smiling. Very good. All right. I hope everyone had a great Thanksgiving as we all pile in this morning. Good, and so we've got a class of some familiar faces, so we're going to get to do some awesome stuff. I'll teach you guys how to stand on your heads and all that good stuff. And you can show your friends at your socials, your social events. That'd be interesting. Actually, I did have a lady one time. We were doing assessments, and I showed her, stand on one foot, feet together, eyes closed, and so the weekend passed. Next time I came back, she says, "Oh my gosh, Chris, you should have seen us all. We had an event here at the house, and I was showing everybody, how I could stand on one foot. Next thing you know, we had several people standing on one foot." And I looked at her and I said, "A social event, right? So were you guys drinking by chance?" "Oh yeah, but that didn't affect us. We were all good." And I'm thinking, oh my gosh. Good thing you signed those liability forms. Yeah. So it was all in good fun. All right. Well, officially, good morning, everyone. Happy Friday. I hope you all had a very happy and safe Thanksgiving with family or friends, and maybe Zoom, some turkey, if that was the case. My name is Chris Williams. I'll be instructor for Balance University Online. You are a part of FGCU Academy Online. I want to welcome everyone to the new FGCU Academy. Just a side note, we have transitioned our name from Renaissance Academy to FGCU Academy, and you'll notice the logo has changed as well. So that's just an effort to align ourselves more with FGCU, Florida Gulf Coast University. So that's all good things. General safety, you guys know these. Make sure you have a chair, something sturdy. Of course, everyone's a familiar face. So breathing, breathe normal. Certain times I'll instruct you when to inhale and exhale. Otherwise, just breathe in and out as you normally would. Balance University is comprised of the 4 pillars: strength, posture, flexibility, and then, of course, balance. And we'll do 2 exercises in each one of those pillars. With the exception of the balance pillar, we'll do 4 exercises. We will be going off script today a couple of different times. And then also we have a couple of asterisk exercises or highlighted exercises where those exercises, I feel we all have a busy day, and those asterisks or highlighted exercises are what's going to give you the most value for your time. Balance is a cumulative effect. It requires practice every day. And with a busy lifestyle, if we can identify those movements that give us the greatest value, maybe we can stand in the kitchen or where have you and work on our balance as time passes. But we have to work on it every day. All right. Questions. Remember, we'll do questions at the end of each pillar. Oops. And then also we'll do questions at the end of class. So if anyone has a question, just raise your hand. We'll unmute the mic. Also at the end of class, if you have something that you would want to discuss privately, we can put you in a waiting room. And if you'll just be patient, we'll get right back to you, and you and I can do a one-on-one if that's what you would like. So I can stick around for a few minutes after class. Also, any questions or emails, you can certainly email Rose, email me, guys, and if any questions that you may have. So, all right, now that the formalities are out of the way, today's program, believe it or not, week 29. Week 29. How many of you notice your balance improving? How many of you feel more confident, feel safer? Good. How about stairs? Awesome. How about stairs? You guys comfortable with stairs? A little iffy? Yes. Great, great, great. Well, today in our mentions and tips, I like to hone in on different aspects of balance. It's a complex issue, right? We have the vestibular system, the ears and eyes. We also have things that affect our nerves and the mechanoreceptors like neuropathy. So there's a lot of different impacts. The greatest thing you can do, however, is what we do in class, right? And that's the strengthening, and that's the practicing with our balance. You see, every time we work in a proprioceptive environment or a proprioceptively enriched environment, connections in our brains get stronger and they become more and more familiar, if you will, with how to position ourselves in that environment. So standing on one leg environment, I am establishing connections that are becoming more and more familiar each time I do that. That's why balance is important to work every day. Now, statistics, all right, and that's what we're going to talk about today, and we're going to talk about money, all right? My favorite thing, or actually it's not my favorite thing, money, right? If you're in the stock market, boy, hang on, it's been a wild ride, let me tell you. 1 in 4 Americans over the age of 65 fall every year, and that's according to the CDC. Now, think about this. 10,000 Americans turn 65 every day. Hold on to that nugget because I'm going to come back to it. Nearly 90,000 people a year are taken to emergency rooms due to falls caused by dogs and cats. I love cats. Listen, I never thought I'd cry. My wife got a cat when my son was born. She just passed away. She was 14 years old. I got to admit, beautiful. I cried. That cat had been a part of my life for so long I didn't even know. I had no idea the attachment I had. But I think, we need to be careful. There are numerous psychological benefits. There's statistics that say 21% of a decrease of those people who own pets. You see 21% of those folks less going to doctor's offices for visits, right? Just for checkups, daily health checkups and wellness checkups. So there's certainly psychological benefits. You just want to be careful with your pets, guys, and as you navigate around, we definitely don't want anyone getting hurt. Back to the money side of it. I read an article this week. AARP did a study and found that $50 billion is the cost for non-fatal falls in the United States of America. Now this gets more interesting. 75% of those costs of those falls are financed through Medicare, Medicaid, or other public health insurance programs. Now think about this. If we have 10,000 Americans turning 75 every day, that cost is going to go up. So by us working on our balance and doing our part, maybe we can help drive some of that cost down. And that's what needs to be our goal. And the hope is eventually we can get some of these insurance companies to start paying for health prevention instead of health modification, right? We want to prevent getting sick, not treat us when we get sick. And so falls are certainly a great, great part of that. And 30% of adults fall annually. That's quite a bit, guys. So that's 3 out of 10 people. 3 out of 10. So, all right. Here we go.